that there's really like a link between like sexuality. I think if we really were to look at it, it's more around a lot of times like expectations about how sexuality should be, how we should enjoy intercourse. Like, not everybody likes penetrative intercourse. Not everybody feels great with penetrative intercourse. And that could be completely normal for them and totally fine. And it's not necessarily asexuality that we start talking about there. It could be like someone who's like completely, like cisgender, heterosexual, they do love sex, but it's not like penetration just doesn't do anything for them. So that can be completely normal for someone who might be on the asexuality spectrum. They could be anywhere on that spectrum. They could like not enjoy intercourse at all, have no desire for it. And if there's no sexual desire, there's no arousal, then often you might, not often, but you could have things like pain with intercourse, because it's just saying like your body's like, well, we don't want this right now. Like, we don't want penetration. We're not aroused. And that just might be your normal. And so there could be a link there. But I would say that, like, tension-wise, if you were going to diagnose with vaginismus, which is like a specific diagnosis where you have to have pain or, significant distress about intercourse and penetration for over 6 months, like that might not be an accurate diagnosis for that person. But they could have tension issues because maybe they work like a hard job and they have tension all over and they just have tension issues. So I wouldn't say that there's like any real link between sexuality and things like vaginismus or pelvic floor dysfunction. I would say it's more probably related to the like social aspect of it and how we feel about ourselves and how we feel about sex and who we're having sex with and whether that actually is aligning with our sexuality. And does that affect our nervous system, our arousal levels, and then in turn that might affect your pelvic floor.